Hope Channel, changing lives.
Good evening and once again, welcome to the program Wounds of the Heart. It's another wonderful Wednesday, the first Wednesday of the month of March 2021. I really appreciate all viewers who have been so wonderful to this program from day one since we started. And today we are here as business as usual, about continuing the talk on COVID-19. Thank you so much. In case you just switch on your TV, your phone, or whatever, we are live on Facebook, Hope TV GH. We are live on YouTube as well, Hope TV GH. And especially we pray that you subscribe to our channels, Hope TV on YouTube. And kindly, you can also share the link as usual on Facebook. And we'll be very glad to have more views, more viewers to watch. I'm delighted just once again to thank Slick Afrique for the wonderful fabric that they always make me looking sleek on set every Wednesday here at Hope Channels. And Slick Afrique, God bless you for the wonderful work you're doing. Don't stress yourself going to town to buy any fabric. Just give them a call. And Slick Afrique will be just at your doorstep, and they will deliver your fabric to you with no less amount to be paid. So don't worry about Slick Afrique. If you want to contact them, the number is 0557 355 852, 0557 355 852, and Slick Afrique will be there. And another gentleman that I really want to appreciate every blessed day, it's my guy, Alpha Art, who had been so wonderful to me with my flyers every Wednesday. Alpha Art, God bless you. Alpha Art Instagram, Alpha Art Facebook, they are there, and they can be trusted at the short possible time. So if you need somebody to design a flyer for you or any letterhead, whatever, please do no harm, and just let's contact Alpha Art, and they will do a beautiful work for you, Alpha Art. And in case you also want to promote your product on Hope TV or Hope Channel, the numbers that are rolling on the screen, you can call any of them and you talk to them. We are still running on a promo, and Hope TV will talk to you. And as I said earlier on, this year we will be accepting invite to your local churches or your corporate organizations to have a talk based on our program Wounds of the Heart. Anything you want us to do in schools or in any corporate organizations, we are ready to come to host the program with you. If you also want to sponsor Hope Wounds of the Heart, please do so. We'll be very glad. You can leave your contact on our WhatsApp platform. That is 0559 680066, 0559 680066, and we will talk business with you. If you really want to sponsor this program, I'll be very glad to also meet you. Today, we are talking about COVID. We started last 2 weeks where people started sharing their experiences, with us and the ordeal they went through when they got contacted with COVID. Today, I have two handsome gentlemen, family physician who had practiced for about 16 years and a member of the National COVID-19 team, and the medical superintendent for Ga East Hospital. He's right here today. He has joined us, and very soon you're going to see him. He's Dr. Ebenezer Odro. You're going to see him pretty soon. And I have at my senior Philippian to me, who will also join us straight from afar, the state. He's a mental health practitioner. And they're going to talk to us about COVID. And today we're going to add the vaccination that had been something else in yesterday. Ghana, we took off. President started his on Monday, and yesterday nationwide. I know that probably at the end of this program, you will make your mind certain to have the vaccination. Gentlemen, welcome to the program Wounds of the Heart.
Well, there's too much wounds to the heart.
Thank you so much, Intime. Thank you so much. Although I've introduced you guys, but I would like Senior Intime to give me a brief intro about himself, so that where I didn't get it right, he can correct it wherever he is. So Senior Yintumi, let me come to you. A brief introduction about Senior Yintumi and how many years you have practiced this thing, so that people know that I'm talking to right people today on my program. So Senior Yintumi, can you kindly briefly introduce yourself for my viewers to know?
Okay, the man of God barely ever gets it wrong. So you sure did get it right with my introduction.
Thank you so much.
My name is Philip Ofori-Yintumi.
All right.
I am a member of the Seventh-day Adventist Church here in Cincinnati, Ohio.
Okay.
I used to worship with Ofanko SDA in Ghana.
All right, thank you so much.
So in terms of my practice, I've been with the mental health fraternity for going to 10 years now.
All right, that's wonderful.
And I've worked in various roles from as an aide, floor nurse, charge nurse, supervisor, now a practitioner. So that is a bit about my background. I also educate people about mental health.
Okay.
So if you go on the social media channels, Feel Good Services.
Okay.
And the goal is to educate people about mental health so that they can have the basic understanding of what it is, because the perception of our society really does not meet the actual of what it is, and that is why.
Thank you so much. Thank you so much. Doc, please, I said a little about you, but you can also add a little about yourself so that my viewers know whom I'm talking to or whom will be leading on discussion today. Doc.
Yeah, thank you very much, and good evening to our viewers.
All right, good evening.
You didn't say a little, you said a lot.
All right.
You did a very good introduction.
Thank you so much, Doc. Thank you so much.
Only missing part was that, yes, I'm also an Adventist.
Oh, that's wonderful. So today I'm privileged to have able Adventist men who will be helping today's discussion. And you can, if you have any question for Soreba, please kindly send it on our WhatsApp platform 0559-680066 or on our Facebook page, Hope TV GH, and we will take time to read them for you. Before I come in to go to Cincinnati, Ohio, I want to begin with Dr. Ebenezer Odro-Mensah. Doc, once again, welcome, and let's begin the business. Doc, COVID started way back last year, and there were a lot of awareness, there were a lot of advocacies about COVID-19, and now we normally neglect the health workers or frontline lineness. Today, we want to know this, how you guys associated yourself with the new normal, COVID-19, and as a team member of the 19, what can you say about the existence of COVID-19?
Well, thank you very much. As you rightly said, COVID started in Ghana in March 2020. I recall the first patient we admitted. I was then at Greater Accra Regional Hospital, what we popularly call Ridge Hospital. We were training the staff there to manage COVID-19 should one arrive in Ghana.
Okay.
And then during the simulation exercise, we had information that someone had tested positive as was being brought. We initially thought it was a joke, but later proved to be serious. And that was how come our first patients was admitted at Ridge Hospital.
Okay.
Back in my facility, guys, we got involved somewhat in first March when we received our first patient. And this 100-bed hospital has since then done only COVID. For frontliners, because there's a health issue, it's only natural that we are the ones to be at the forefront. I must confess that quite a number of us were scared initially, confronting this condition, because prior to our first case, all we've seen on TV were deaths. People in infectious disease centers, ICUs, intensive care units, and they were dying left, right, center. When you turn on the TV, you hear about death. So yes, it was quite scary.
Doc, continue, please. All right. So, Doc, at the end of the day, when you as you're saying, we switch on our TV and on all that thing, psychologically, doctor have said that it was problematic. Mr. Philip, to me, with what the brief thing doctor has said, psychological as a mental health practitioner, how did you also take it, and what was the concern that was coming to your table?
All right. So when most people or most occupations, most workers were allowed to work from home because of this very pandemic, health workers and its allies, people like housekeeping and stuff like that, really did not have a choice. So we had to go in to be able to help those with the condition and affected by it one way or the other. So this brings a toll on us. This puts a lot of stress on us because you see your friends, your colleagues in other fields having the luxury of working from home for the fear of contracting the disease and passing it on to others. But then you are then mandated to go into work. So psychologically, it puts you in a vulnerable population or a vulnerable spot. Because then it's like, what did I do wrong, right? Because everybody fears. Though we do have that obligation to help people, we're not running away from it. But then when everybody is faced with death, the reaction becomes different.
Exactly.
As Dr. Hodromeza said, they got scared. And that is the reaction across the globe. We all get scared when we are confronted with such a thing.
All right. So, Dr. Hodromeza, so you were saying that the fear was there, but as part of the team, COVID team, did you go to places, and how many people have you seen dying out of COVID personally? Hello, Doc. Hello, Doc.
Yes. Hello, can you hear me?
Yeah, I can hear you. So if you can hear, you heard the question I said. All right, so Doc,
yes,
let's hear.
Sorry.
Don't
if you look at the national data, involving over almost 500 deaths, you know that quite a lot of people have died. In my facility, we've had about 30 deaths from COVID-19, and that's quite a huge number. Most of them having passed away between January and to date. It's scary. A lot of us out there do not think there's actually COVID. But with the frontline health workers who are constantly faced with seeing death from a condition we know
I think Doc's line is. I think Doc's reception is. So Philip, continue from me. So fear factor, continue from me, Philip. So that with this fear impacted in us, or us entertaining this level of fear, and then you see people not complying with the regulations, not wearing the mask, not staying home, not engaging in activities that they shouldn't be engaged in. It makes you to be more stressed out about this pandemic, because now there are people that are going to have it for one or two genuine reasons, right? Just like health workers, we work in the hospital, we put ourselves at risk. Therefore, there's that chance that we might contract it. There are some people that might get it with no fault of theirs. So yes, we're taking care of these people. And then you have this group who will not comply with anything that the professionals are telling them to do. So it really gets you more anxious, if not more angry, when you see stuff like that happen. So those are some of the complications that the health workers themselves deals with. All right, so Doc, I'll come back to you, but then coming back to you, what I want you to do is that I would like you to, you will give us some of the points that the health workers psychologically might be affecting the health workers. So after Doc, I'll come back to you. Doc Mensah. Doc Odro.
Yes, I can.
All right. Yeah. Okay, so continue for me. I asked that.
On my phone.
Oh, no, I don't. No. We wouldn't mind them. So, how many people have you seen dying personally, and how was the feeling like, Doc?
I really can't put a figure on it, but I must say at least about 1/3 or about 1/4 to 1/3 of our clients who have died, I had been present either immediately they died or just before they died. And it's disheartening. Let me confess that I just recovered from COVID myself.
Oh!
I've been downstairs, yes.
Whoa!
I resumed work officially on Monday. Most of February, I was on admission and then home isolation.
Whoa!
Yes, it's a big deal. My exposure was from attempting to save someone from dying. I went in to intervene without appropriately getting dressed because I was in a hurry to go in, and I did not follow my protocols, and I got infected. But that is how bad it is for us, the health workers. When you see somebody dying, you think you can do something, you know, and yet it takes you 10 to 15 minutes to dress up fully and go in, and at times any delay at all
can
have an impact. So you at times are in a hurry to just go in and do something, you know. So we don't want to see anybody die. Nobody likes to see that, but it has huge psychological impact on us. I can always picture this gentleman's face, the processes he went through, how he struggled just to breathe. We walk around breathing air freely. There's oxygen, somebody is struggling to breathe. We are trying to push oxygen into him, and he's still not taking it. It leaves a huge impact, not just on the doctors, but the nurses and other people who are involved as well.
Exactly. Mr. Yen, to me, Dr. Riley said that he himself just recovered and he's still going through that, having that traumatic experience with this gentleman who he still says that he can't take his mind off from this man. As a practitioner, mental health practitioner and psychiatric practitioner, what can we do to help doctors and nurses and especially the frontline workers from your office?
Thank you. And that was going to be one of the things that I was going to talk about. You know, who watches the watchman?
Exactly.
With all that they go through or we go through on a daily basis, is there a support system where we're providing psychological support for these workers? Yes, we do see cases in the emergency room most of the time and all of that, but you never get used to some of these experiences because everyone is very unique, right? And so healthcare workers usually tend to have PTSD from what they go through, but then it goes unrecognized and undiagnosed and untreated, which is not healthy for the healthcare workers themselves. So for Dr. Joe Mensah and in his position, hopefully he can have a team based on his experience, have a team in the psychological department where they can provide support to the staff. And this should be encouraged and announced so that at least maybe once a week, twice a month, people will pass through and then just have the safe environment to vent about what is going on, because part of it is not just the frustration of people not doing what they have to do outside. Part of it may be systematically what is wrong. How are we exposing ourselves to these conditions? How are we being made vulnerable? Just as doctor walked into the condition without having the time to appropriately prepare, because it's so difficult to watch someone die or someone suffer when you know you are in the position to help. Sometimes we take the risk of us getting a condition or a disease at the expense of helping others, right? So I think there should be that avenue for the health workers to be able to safely vent what they feel is frustrating for them with the system, with the people, and whatever else they have going on. The other thing also is for us family members or relatives, when our loved ones who works in the hospital is to come home, please let's not stigmatize them and be like, oh, he just came from the hospital, so let nobody get close to him, right? Yes, I do understand why one would think that way, because we don't want to contract, because they've had that risk of exposure being out there. But driving that person away, isolating the person like you are at outcast at this point, also traumatizes the patient, because these are my loved ones that I've associated with and lived with, and now I can't get close to them. So once we get home, let's take the necessary precautions to wash down, change, and all of that, and then the family, as we safely can, provide some emotional connection and support to these individuals.
Exactly. All right, so thank you, gentlemen. In case you're watching and you are a health worker or frontline worker, or you know someone who is a health worker, and he or she has shared some experience with you, you can just connect with us on our WhatsApp platform or on our Facebook page, that we can also have the interaction. The gentlemen are ready to answer any question, to speak about any concern that will come our way. So please, so please don't hesitate to join us. I'll go for this break. When I come back, we're going to continue and we'll enter into the vaccination thing proper. So please don't go anywhere. We will be right back.
Hope TV ahwefo may the Awurade Yesu din chia mo soronko baby a wo bia. May the Lord richly bless you. The station is so proud of you for your support, for your prayers over the years. Enye mo ka TV station ye ni ha. Mo kakra mo de suma efa mo so ba checks ahodo amotwetwe na ma TV station ye da so a ye te ase a ye di nyame asem nam so bremo. We are launching on the 6th of March. Givers platform for Hope Television. We want to raise 1,000 human beings, 1,000 people who are willing to give this TV station 100 Ghana cedis every month, so that we'll be able to buy new machines. Near to me, for one or year, Hope TV and be a home. Merantene Mario or Moya Juma Hanomusa. There's the need for us to augment our workforce and then expand our coverage. We need money. So on the 6th of March, we'll be here to launch the Hope Club 1000. All that you need is to just send your number to 0249193083, and then we'll hook you up onto the platform. You become a Club 1000 member. That every month, Bosumi be 100 Ghana cedis, so that we'll support what we want to do. We look forward to seeing on the 6th of March as we officially launch the Club 1000, and then every month the promotion will go on. May God richly bless you as you prepare to send your name and your number to 0249193083. That, Pastor, I just want to be part of the Club 1000. And the Lord will make sure that every month He will give you the 100 Ghana cedis to send it to this TV station. May God richly bless you.
Hi, welcome back from the break. Thank you so much for sticking and staying with us. The program is Wounds of the Heart. In case you just joined in from Facebook or YouTube or on your home TV, we are discussing the psychological effect of COVID-19 on our health workers. Dr. Dro is online. Mr. Philip Yentumi is also there, and doctor said that he's still traumatized about this gentleman because at the end of the day he didn't want him to go pass on. But I also have I knew a doctor who said that he almost committed suicide because of COVID. A whole medical doctor who had been seeing people having COVID, treating them, saying he wanted to commit suicide. Senior into me, as a psychiatric practitioner, please, this tells me the impact of COVID-19 on our health workers. What will you add in helping such people, our frontline workers?
So, as I mentioned earlier, the PTSD and the frustration that we go through as health professionals dealing with these kind of situations, right? So now, with a medical professional who is helping people and seeing all these non-compliance and all of that, and probably have contracted and they feel that there's lots of hope, will probably come to the conclusion that at this point it's not worth living and want to die from suicide. I'm not saying that is the option, far from that, and that should not be the option, because the data shows that there's way higher recovery in cases than those that passes on. So we should have that hope. But then, as part of what we can do to help our health workers is to assist them with where to isolate.
Exactly.
Right. So I'm not going to talk about the systemic one,
no.
Whether government or health workers, no, as family members.
Exactly.
Because I always want to talk about what is within our remit, okay? So as family members, as friends, where to isolate? So let's say I do have a brother who is a healthcare worker. He has an exposure, which he believes that he might have it. That is one. Two, he has the COVID, right? And we know very well that this brother of mine lives in a one-bedroom house with his family. What can I do
to help
this brother from being frustrated? So in that case, I will suggest that we provide support by saying, hey, can we have your kids over? Can your wife come stay with me? Right? So we can take the wife and the kids. Let's say I don't have enough space to accommodate your whole family. What about between myself, my other siblings, my cousins? So let's come together and provide this helping hand. And then the next thing is, think about how nice it would be for a healthcare worker to come back from work and then have provisions at the doorstep to welcome him or her that, hey, thank you for what you do for our brothers who are sick, and this is what we can also do to help you in this very difficult situation. Because you agree with me that some of these healthcare workers, due to the long hours that they work, probably may not even have the time to go for grocery, right? To go to Malata or Domain Market to go buy their own stuff. So you taking that extra pain to do it, and let me say, it's the thought that counts, not the quantity of it. So I'm not saying go buy a whole truckload of stuff and bring it to them. If you can, that is great. If you cannot, just a basket full of fruits or something. Just that gesture goes a lot to let them know that, okay, I have people who thinks about me and people who cares about me. Any form of support that we can offer to these individuals goes a very long way in helping them to also have some sense of belonging, acceptance, and also having the drive to continue to help the vulnerable.
All right, thank you so much. So, Dr. Dromens, that is from a psychiatric practitioner. Doc, with what you just said, I know that you when you isolated, a lot of things happen, and by the grace of God, we thank God for bringing you back to work. Doc, it has been speculated that it's only zinc and vitamin C that can give the boost to the body system to accommodate this COVID virus. How true is it only? And what do you think we should do? Is the vaccination a good option to what we are saying?
Well, thank you very much. There's been a number of studies, not to discount the role of zinc and vitamin C in helping the body in terms of immunity. But then that alone in no way will protect you from contracting COVID. Zinc and vitamin C basically helps the immune system of the body. And that's what it does.
Oh, okay. So aside, sorry, Doc, please continue.
Yes, vaccines are coming, and it's important that we all put our weight behind the rollout of these vaccines. There are a lot of myths, misconceptions, and theories about these vaccines, how it's targeted Africans, etc. They are all false, honestly. From the medical and scientific point of view, these are all false. And I think right from the past, we have lined our children up to receive vaccines as we grow up. Our parents did, and we have done to our children as well. And our children are going to do to their children's children, you know. And there's nothing bad about vaccines. Yes, we are all probably worried that these vaccines have been produced so quickly as against previous vaccines. But so has technology progressed. Let's look at that aspect. The vaccines our parents had, the polio, BCG, hepatitis vaccines our parents have had, are different from what we are getting because due to technology, there have been changes, there have been improvements. So even the vaccine you are getting today, it's likely we could have an improved version in the next few weeks, months, or years.
Okay.
Doesn't make the vaccine you are getting now bad. But then the positive effect or the protective effect we will get, no matter how small it is, I can assure you, I have had COVID before, and if you have had COVID before, you will not say no to the vaccine. And yes, I have had a lot of calls from post-COVID patients who are asking for the vaccine. Can they come to the East and take their shot? They are even pushing for it more than those who are yet to get COVID because they have experienced and they know they do not want to get into that situation.
All right, so Doc, let me ask you before we come to senior unit. Doc, the vaccine thing, you said that there are myths and we should discard the myth. Yes, we will discard the myth when the public understand or understand what it is. I heard that even the frontline workers, especially the doctors, are even divided when it comes to this vaccine. Others are saying it's good, others are saying it's wrong. So if a doctor or doctors whom are going to help us to understand the reality of these vaccines are divided in terms of we injecting ourselves. Doc, don't you think that it will also have a toll on the general masses about whether or not we should take it or not? Doctor, can you help us in here?
Yes, it is true. Even among the medical fraternity, there are divided opinions as to the vaccines, whether it's good, whether it should be taken by what age groups. Research is still ongoing. Findings change on a daily basis.
Okay.
Even research today can say no and change tomorrow.
Okay.
But then our decisions are not only influenced by our knowledge. Our decisions can also be influenced by our background and our previous experience. So amongst two siblings, they can be very divided over a single issue. That somebody else's are very clear-cut.
Okay.
But you can have different opinions about them. It doesn't mean that one is probably better than the other. We need to look at the science behind it.
Okay.
Weigh the risks against the benefits.
Okay.
During the first wave of COVID, we were relatively spared. We have very few deaths. We had huge numbers of infections, but few deaths. And we thought it was okay until we hit January 2021.
Okay.
And then we started seeing the deaths. And almost 70% of our deaths have occurred within 2 months. In 2020, we spent 10 months during COVID. And yet, within 2 months of COVID, we lost 70% of our patients here. So that tells you the magnitude of what is happening, the changes occurring, the virulence of the organism we are dealing with. Okay, developed countries are locking down, even in spite of the presence of a vaccine. They are still locking down because of that. Let's not take things for granted.
Doc, we are not going to take things joke. I'm asking questions for my viewers, those of us who still have this perception or this conspiracy theory about what is happening. Doc, so assuming all of us get vaccinated, will we stop wearing nose masks? Can we have that one-on-one contact? Would there still be the need of social distances or here and there? Can we live a normal life after everyone in Ghana had vaccinated?
Well, the research is still ongoing.
Okay.
As we know it now, what we are sure of is that the vaccines protect against severe disease.
Okay.
So if you have the vaccine, then you are less likely to develop a severe disease requiring oxygen therapy, even leading to death. But science hasn't shown clearly whether it protects against transmission of infections or even getting the disease. So what it means is once you get the vaccine, yes, when you come into contact with COVID, you may have the infection, but it will be a mild infection. And let's remember, a lot of people have mild infections. Not all COVID ends in the hospital, ends up in the hospital with oxygen and that. Quite a number of people get a mild infection. A number of people do not even realize they have COVID.
Exactly.
But you may not know who will be mild and who will be severe. It is not written anywhere. When I was exposed, the young man I was exposed to was a young man just like me, even younger than me. well physique, everything. No comorbidities, not hypertensive, not diabetic, and yet he succumbed to COVID. So you can never tell who will develop the severe disease and who will develop the mild disease. You may be fine, but you may take it home to your mom or to your dad or to your granny who develop a severe disease and die from it. So that's what we are trying to prevent.
Right.
So for now, yes, no data shows that once you get the vaccine, social distancing stuff, wearing of face mask stuff, etc. Yes, there may be a reduction in the various protocols that have been put in place, like
the ban on schools or here and there, the ban on schools.
The ban on schools and those things, yes. All those things may go away. We may have a more engaging life, getting to almost the old normal. But can we get exactly to the old normal? I don't think. It will take some time.
All right, so doctor's telling us that it may take some time. Doctor is being frank on my program because we need to deal with what is happening so that at least we can psych ourselves to accept the good thing to help us live a well life. From Samuel Chumesi, he said, thanks for giving us such a program, very educative and needful. Sami, thank you so much. From Elder JB Fojo of Penkwase in Sunyani, he said, thank you very much for this timely and very educative program. Once again, I will say thank you and may God bless you. Elder, God bless you too for your comment. You can keep your comment and question coming because I've started asking mine. If you have any question about a vaccine, please, doctor is on. Senior into me is also on. Please bring them so that we can ask them. Don't wait till the program is over. Then you keep the question coming. Please, I'm very glad that you come on. All right. So, doctor, the last thing I'll ask you before I go to Senior into me, please, with the vaccine. Some are also saying on a lighter note, I don't know how true it is, that when you get yourself injected, you start feeling, you be shaking. I don't know. If you have vaccinated, is it true that that thing is it's there?
Well, I smart that you thought of it. The vaccinations began on Monday.
Yeah, exactly.
And I was surprised at the numbers that turned up during the launch in the Gais municipality on Monday. Yes, to be vaccinated. And for most places, we've seen quite some queues building up to get for the vaccination exercise. I'm yet to hear of anybody shaking or having twitches or any such thing. Now, let's remember that in this world, we differ in our genetic makeup and how we respond to foreign bodies in our body. Some people might respond in a way that is beyond the normal. For most vaccines, even for children, if you remember, when you take your child for vaccination, they will tell you, well, the child may have a fever. Some of the children, the babies get a fever after vaccination. They get a bit of pain and swelling at the site of vaccination. Some paracetamol and Rabin, and they are fine. And that's exactly what happens to most people after this injection. You may get a slight pain at the site of the injection.
Who is? All right, Senior Philip, you are the psychiatric mental health practitioner. These questions I'm asking. Probably you have heard some. You've got yourself acquainted with some. As a mental health practitioner, what will be your take on? Is doctor on?
Yes, I'm sorry.
All right, so doctor, and so that I go to
Yeah. So really, what we've been seeing on social media, people shaking and dancing, is not true. That hasn't happened yet.
All right, Doc. So back to Senior referring to me. Senior, yes, I asked. So what is your take on such questions that a layman will ask? Because he or she has heard people saying about this conspiracy theory, because they said the white people want to tarnish the blacks, and we are bringing this COVID freely to Ghana first. What are they thinking? Senior, please, can you counsel the public about the hearsays of people?
All right, thank you very much. And I keep laughing because I saw a picture of our president.
Yeah, exactly, having a hair.
If that is true, then I will take a double dose.
Exactly.
Did you get it? Okay.
I get you. Yeah, it's true. Yeah, okay. What I see. All right, Senior, let's go.
All right. So talking about the experience from getting the vaccine, I would say that I've received my double doses of the vaccination.
Okay.
Right. So I received my second one last Friday, and as Dr. Joe Mensah clearly said, we all react very differently. I know so many people that received the vaccine. Some people received the first one and did not have any symptoms. Yesterday, one was telling me, I just received it, moved on like nothing happened.
Nothing happened.
I felt a bit sick after receiving my first one. It lasted for about 16 hours, and I was fine. Even with that level of sickness, I was scheduled to preach on the Saturday. I received it on the Friday, scheduled to preach on the Saturday. I was still able to go to church and preach.
Wonderful.
So I'm trying to let you understand the level of sickness I'm even referring to, right? In the same vein, my mom had received hers the Thursday before the Friday I received mine. She was still down on the Saturday. And some part of the Sunday. So hers took close to 48 hours. But then after that, she was fine. But let me say this, before I even get to the psychological part and all of that. Now, the symptoms that I've seen people go through after receiving the vaccine is not anywhere close to people who have actually had the virus and has gotten very sick from it. Do you get the point I'm making?
Exactly.
So to safely say, even the reaction that you have from the vaccine, the worst one is still safer than the best case of coronavirus. And I'm not saying that's exactly how it is, because I know some people are even asymptomatic with the virus. But what I'm trying to say is people who really get sick from the virus is worse. So you're much better off receiving the vaccine than not receiving it. The other thing in terms of, they're going to kill you, and I've seen so many videos, heard so many voiceovers about all these conspiracies. And I love to listen to them so that at least I can use them to educate. Now, somebody said that if even you take in the foreign country, when it gets to your turn, they're going to draw from the black people vial and give it to you. Please, it's not true. Because the way the system works, they don't know who is coming next, and you're just going to receive the dose. There is nothing like, let me tell you this that I also saw on Facebook. If you think that the vaccine is really coming to kill us, we live in a country where everything, including toothpick, is imported. Think about it.
Okay. Then it's okay.
So, right. So I think that settles the case on that one. So now let's move to some of the psychological builders. So now we say that leadership by example, that is one. Two, a picture is worth more than 1,000 words, right? And three, show, don't tell. And that is why, as part of the rollout plan, it's the fact that the president or the presidency took theirs first. Opinion leaders taking theirs, stakeholders, right? So when these people are to take it, and then we see them take it, it influences the decisions of some of us. When they also show us how it is done, and the people still living and walking about, then it also change our perception. So now, let's say there is 50 people who had a misconception about this vaccine. After the presidency took it, the number is going to reduce. After the pastors and the traditional leaders also took it, it will reduce further. Now, the media men and then the medical fraternity is also taking it. It will reduce much further. So for anyone at all, I might not be an opinion leader, I might not be a pastor or anything like that, but somebody looks up to me. So if I'm to go and take it and show that, hey, I have taken mine, it convinces that person that, if Kofi has taken it, then I can also take it. So it's very important that we go on and take it. Now, if you want any form of normalcy to happen, the best thing to do is to take the vaccine. If not, then you're just making it more difficult. And as for the topic for today is, you're putting more stress on the health workers, which frustrates them the more, and which sometimes makes some of us to say certain things that takes us out of line, because it's like, Masa.
It's true now. So
right. So sometimes we have to make it easier for the people in charge, so that they can also have the good heart to take care of us. Let's not frustrate the system any further than it is.
Before I go to Dr. Drew Mensah, let me come back to you, for you to me. You see, the commoner, the layman who heard doctor saying that if I should vaccinate now, it still doesn't stop me from getting over COVID. Over COVID, definitely I might be having mild ones here and there. So why wouldn't I stay and take my Sobolo and do my neem tree thing and get on? As a mental health practitioner, what will you tell such a person who has such mindset?
Okay, Dr. Drew Mensah mentioned earlier, our opinions are formed by various reasons. So psychologically, we think that, you know, the exposure to what people have told us, what we've seen, all these things are shaping our opinion, hence the hesitancy in doing some of these things, right? So now you've taken the virus, there's still that risk of you getting it. He clearly mentioned that it stops or it reduces the tendency of you having a severe case. So yes, he did mention that you may have it, but look at what we are talking about. Mild symptoms to severe symptoms. So it's two different things.
Exactly.
Let's get that one clear. The next one is that you may not even get it after having the vaccine. That is also another thing. Now, the point is, oh, if I get it, I'll get out of it because, you know, I have a good immune system, I'm more physical and all of that. Now, we see more younger people dying and having more complications than when it first started, right? So that argument really is not true. And how do you also determine what symptoms you're going to have after you receive it? There's no telling. So please, let's do it. And if even for the sake of argument, you know, if even you know that you have a very good immune system and you're not going to get it, or have complications of it, now you may be a carrier. So just do it for the sake of others. And let me make it sound more bad for you, right? Let me make it sound more bad for you.
Okay.
If you don't get the vaccine or do not do anything against contracting the virus and passing it on, you may be committing homicide, which is killing other people on purpose.
Exactly.
So you don't want to be homicidal. So please get the vaccine, take the precautions, do what you have to do, so that you do not be classified as a homicidal.
So if you don't want to be a homicidal or kill other people, just get vaccinated so that somebody closer to you would never be infected. Doctor, let me ask this. There are some medicines that it is blood group related. That probably group A can take, group B can take, or some people's DNA might not help them to take some part of some kind of medicine. Is COVID the vaccination? Is it straight for everyone, irrespective of the group, irrespective of your DNA?
Yes. Currently, as it stands now, there is no selection for blood groups when it comes to COVID vaccine.
Okay.
If you recall, the only group some of the vaccines were even not recommended for, that is adults above the age of 65 and children below 18.
Exactly.
The current studies have changed that. And in countries like France and some of the European countries, they've gone back. And they are now looking at giving these vaccines, even those outside these age groups.
Oh, okay.
The adults and the children below 18. So let's look at it again. As it stands now, a lot of studies haven't been done in pregnant women. And so there is some caution in pregnant women to weigh the risks against the benefit. as more data becomes available, we believe that we'll be moved away from this. Because some vaccines are being given to pregnant women. Other studies haven't been too conclusive. But then, even then, I must say that we usually weigh the risks against the benefits.
Exactly.
And in most cases, the benefits far outweigh the risks, because most studies have shown that it's injurious to the pregnant women. But drug companies tend to want to be cautious and progress cautiously because of issues of suing and etc. So yes, regarding blood groups, etc., there is no such selection. Any blood group can take the vaccine.
Okay. All right. So I think that I have less than 10 minutes to end the program. I'll give Dr. Drew Mensah to wrap up with his final words, and then I'll move to Cincinnati for Ofori to me also to give his final word. Then I will bring this the curtain down on this program. So, Doctor, should we go out there to get vaccinated?
Okay, thank you for hosting me on this program. Let me just start before I answer that question directly to talk about the psychological impact briefly. And our brother mentioned it. Still relating to the vaccine, kindly go out and take the vaccine. The more people come down with COVID, the more the healthcare system is strained. We have people with hypertension, diabetes, so many other medical conditions who do not get access to medical care because of COVID and how it's affecting healthcare workers. A lot of healthcare workers are under quarantine, they are home because they've been exposed. And that reduces the workforce. It also puts a lot of psychological pressure on us. The more people we have to take care of, the more stressed we are, the more traumatized we are, and it affects the quality of care. If quite a number of us have the vaccine, then we are less likely to see very sick people with severe disease. And that also frees us to cater to other health needs of non-COVID patients. So please, let's go out there, let's take the vaccine.
All right, Doc, a question has come to my set. I said, please, good afternoon. In a second, tell the one who sent this message, why are pregnant women and people under 18 excluded?
Yes, you know, this vaccine was developed over a relatively shorter period as against other vaccines. And therefore, studies are still ongoing. Pregnancy lasts a period of 9 months. So it takes quite a while to observe, to do trials in pregnant women, observe the data, and come up with conclusive findings. Because remember, the vaccine has been developed within a year. Again, in younger children, during the vaccine trials, the focus was not on young children. The focus was more on the older folks. So now trials are starting younger children. And as I said earlier, it's important that these pharmaceuticals protect themselves from litigation. So once they haven't come up with conclusive findings, they will indicate that as a question. It is not contraindicated. It is just a question. That you weigh the benefits of taking the vaccine against the risks. So pregnant women, yes, are taking the vaccine. But then if you are not sure, then you weigh your risk against your benefits. That's why most of the recommendations will tell you that if you are a frontline health worker and you are pregnant, take the vaccine. If you think your risk of exposure to COVID is very low, then you can abstain. But if you think your risk of exposure is high, you are better off with the vaccine than not without the vaccine. Because what is the use of a dead woman who cannot to the baby? The baby is dead also. But if you are alive, at least you have a severe disease. If you lose your baby, you have the opportunity to have another one. Go for it, another trial. So you weigh the risk against the benefit. It's not a contraindication.
All right. So, Ofori to be senior.
Yes, sir.
All right. So your conclusion message for my viewers.
All right, so thank you, cherished viewers, for watching and listening, and I hope that you've learned something out of this. All that we're saying is coronavirus is real. It's deadly. There is hope, and as part of the hope is the vaccine. So please, let's all take it. Most importantly, for the subject of today, which is the strain or the psychological help that we can provide to our healthcare workers. Let's also realize that they are human and not really superhuman. So they also need the compassion, the love, and all that it comes with that they can get. So please, let's offer a helping hand. Every little counts, right? This is not the offering that we have in church where but in this case, I would say, nothing is too small in terms of help that you can give to a healthcare worker. So let's extend that helping hand so that they'll also have that good heart to be able to take care of people. And finally, let's also still observe all the necessary precautions so that we do not overburden the healthcare system that we have, which is already impoverished, malnourished, and suffering. So thank you very much.
All right.
And we hope we all listen.
All right. So viewers, you heard it for yourself. Dr. Drew Mensah, Philip Ofori to me, a mental health practitioner, psychological mental health practitioner, and a family physician and the head superintendent of Gan East Hospital, where on my program they were talking to us about the psychological effect of COVID, the impact it has had on health workers and how we need to help them. We've said a lot, and if you are late watching this program, it's still on our Facebook page, Hope TVGH, and our YouTube page. You can subscribe and you can also watch. If there are any extra questions, you can ask. You can still send them. I'll forward it to them, and when the answer comes, I'll give you the answer as well. Please, the vaccination, you've had myth about it. You have heard people talking about this vaccination thing that it's about taking the life of a black man or African, wiping away Africa. Yes, and Senior Yentumi said something. I think that I'll bring it again. That all things we use are toothpaste, whatever is being imported, and if they want to kill all of us, don't you think that they can put something in to take our lives away from us in just a second? Let's think about it. And doctor said we should weigh the benefit from the least one. And when we weigh the benefit, it is better for us to get vaccinated, that none of us will perish. And as we are getting vaccinated, think that someone has never vaccinated. So the precautionary measure is still intact. Nose masks should be on, washing of hands should be on, and the sanitizing should be also on. Please don't throw them away. There are a lot of people walking on town without nose masks, without doing all these things, thinking that it's a myth. Please. By the time you realize, you might find yourself in a hospital where no one can save you, because the doctors also might say that you have never vaccinated, and you can cause psychological effect to them also. They don't want to be traumatized. Doctor had COVID, and I wanted him to share his ordeal what he went through, but yet he has said a lot. Those of us, or those of you who had contracted COVID before, are running to go get vaccinated. Some of us at the point in time, we've realized that we had a mild one. Please, let's also go there and get ourselves vaccinated. The doses are minimal, 600,000. There are more to come. If you have not psyched yourself yet, today, my doctors and my mental health practitioners are saying we should go out there and get ourselves vaccinated. Dr. Odro Mensah, Ebenezer Odro Mensah, God bless you today for being on my program. Mr. Philip Ofori to me, God bless you for being on my program, for talking to health workers or frontline workers. And I know that we have learned a lot from it, and we're going to help other people whom we think couldn't have time to watch this program. We need to watch and send the link to them, or also help them out. And today I'm happy. And I know that from today, if in case you have it in mind that you're not going to vaccinate, today you've had a different opinion to go get yourself vaccinated. Until then, I've been your regular host on this program, Wounds of the Heart. Silika Afri, God bless you. Alpha R, God bless you. And you, who had been watching my program from day one, God richly bless you. Senior to me and Dr. Odro Mensah, if you are still on, I said God bless you for joining in. And I have been your regular host on this program, Pastor Daniel Albedo Bidiaba. I am out.